Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Long Island Jewish Hospital to help you understand what's going on with COVID-19 in our communities and across the region. And of course, we want to hear from you. This is a call-in show. Call us at the number at the bottom of the screen, 516-393-1800. Well, grim new warnings from Governor Cuomo as the pandemic spills over into its second month. Now, Cuomo says models show the apex might not even hit until the end of April, and the high death rate that could last through July. Positive cases in the state now nearing 84,000 right there. You can see all the numbers. Nassau County, just under 10,000 of those cases. Suffolk cases, those continue to climb, a little more than 7,600. Now, the death toll across the state, still staggering. More than 1,900 lives claimed so far. 76 died in Nassau County, 69 in Suffolk. 25 of those in Suffolk. That's within the last 48 hours. Now, County Executive Malone says since the mourning process is upended due to the virus and the anguish of the families, that's still just heartbreaking. And today the governor announced the closure of all New York City playgrounds. That's due to people ignoring the social distancing guidelines. He says local parks will remain open, though, so people can still get outside and exercise if you want. Now, you can find out if you have the coronavirus within minutes. 3 Long Island urgent care centers are among the first in the nation to use the new, it's called quick COVID-19 tests. American Family Care urgent facilities in Farmingdale, East Meadow, now West Islip, have already started using the rapid molecular tests. It's the first of the month also. Rent, mortgages, all due. Many tenants, though, and homeowners, they can't pay because a lot of people are out of work right now. Governor Cuomo did order a 90-day moratorium on evictions and signed an executive order that relieves mortgage payments for 3 months based on financial hardship. However, many Long Islanders say the lenders are not adhering to the state's rules. And with the holidays coming, we have 3 of them coming up right now, 4 of them actually. Nassau Executive Curran says we'll have to break tradition and observe virtually this year. She cautions families to maintain that social distancing. Curran says we can celebrate with our hearts, souls, and technology. All right, let's get right to our discussion. Joining me tonight is Dr. Adam Berman, Associate Chair of Emergency Medicine at Long Island Jewish Medical Center. Thank you very much for your time, as always.
Thank you.
Let me start off by asking you, how are you doing, and how are the folks there doing and holding up?
I'm doing well. I think that the entire emergency department as a whole is obviously very stressed, but at the same time has really come together to take care of the patients. We're a big family, and you can really feel that everyone's sort of come together.
Yeah, we appreciate everything you're doing. Let me start by asking you about the new potential tests that are coming out. We have this rapid quick test. Are you using that at your hospital, those tests? I know we've listed 3 places right now that are using it.
Right. We currently don't have that at Northwell. It's obviously a wonderful advance in this whole pandemic. We're still using the traditional test that's been used since the beginning. The turnaround time has come down significantly. So although we're not able to give tests in results in minutes, we are able to give results pretty quickly.
Now, I'm hearing from social media, just people hitting me up on social media saying that they're hearing that those new quick tests are 30%, 20% accurate. Do you know anything about that?
To be honest, I don't, but what I do know is that there are a lot of variables that affect how sort of accurate a test can be. Sometimes it's as simple as not getting a good specimen. So although the test may be better or sort of faster, it may not be the best test for everybody.
Okay. Let's go to the phone lines right now. Mike from Wading River. Mike, you there?
Yes, Stone, how you doing? First off, I want to say thanks for doing the show. We watch every night, although I like dishing Long Island better. The question for the doctor that we have is, we get a lot of deliveries on a daily basis from Amazon. We get mail deliveries on a daily basis through regular mail, and we noticed that no one delivering is wearing gloves, wearing masks. What should our expectations be for disinfecting any deliveries, mail? How should we be handling and kind of receiving those types of items that continue to come on a daily basis?
I think it's a good question. I think that you should continue to use sort of caution with everything the same way that you always should be. If you want to wipe down items before you're using them, that's probably not a terrible idea. We don't think that you should necessarily be able to get the coronavirus from something that's been sitting on a box for days and days and days, but just sort of general hygiene is probably the smartest thing.
On that, as a follow-up, should we also be disinfecting our mailboxes, because the mail, the letter carrier is going to be moving from mailbox to mailbox, and is there a concern there as well?
I don't think that there's a specific concern related to mailboxes, but again, I think that after you get the mail, making sure that you're washing your hands after you open the mail, not touching your face, touching your mouth specifically, that type of thing should help.
Okay. Let's go back to the phone lines. Judy from Holbrook. Judy?
Hi, this is Judy.
Hi. What's your question tonight?
My question is that if I have the virus and I'm at home and I showed signs of it and I get over it, okay, and I quarantine myself for 2 weeks, what happens? Am I still going to be contagious outside? If I go outside after the 2 weeks quarantine, will I be contagious to other people? Will I still get the virus again?
Okay, doctor?
It's a good question. The truth is that you may still be contagious for a short period of time after you have quarantined yourself for 14 days, but by then your risk of transmitting it should be much lower. And the chances of getting the virus a second time are very, very low. There have been a few reported cases of it, but it is extremely rare.
Let me follow up on that as well, because I get this a lot, again, on social media, people asking me this question, and maybe you can just explain this in medical layman's terms. If we're asked to social distance and for a period of time, and that's supposed to stop, if not kill, the spread of the virus, people are asking me, explain why, if once we stop social distancing, that's going to stop the spread. Don't we go out and then we start spreading it all over again?
Well, you're right that if people do stop social distancing, there may be a small increase in the spread of the virus. But if, as a group, we do social distancing, the virus should not be able to be passed between people who are not, very close to each other. So once we've done social distancing for 14 days, the virus should not be able to be transmitted. So it's still possible, but not as likely.
Okay. Back to the phone lines. Mark from Woodbury. Mark?
So, hi, how are you?
I'm doing great. What's your question tonight?
Okay, I'm in Cold Spring Hills rehab in Woodbury, to rehab nursing home. My question to you is, and they treat you very well, but like if you're not sick, if you don't have it, they still have you on lockdown. But shouldn't you be allowed to go outside and stuff like that?
I think that's a tough question. Obviously they want to make sure that you're improving, but also have to kind of take care of the health of the whole facility. So while it might be safe for you on your own to go outside, it may not be safe for the facility as a whole. And we are, making a lot of decisions now about the population as a whole. And unfortunately, that is inconveniencing some individuals. But in the long run, it will probably be best for everybody.
Okay. And I think we have Nicole. I'm not sure where Nicole is.
Wait, I have another question.
Oh, yeah? Okay, go ahead.
Yeah. How long do you...
I'm sorry, Mark. We dropped, somehow you just dropped out. So if you could just call back, we can try to get that second question answered. Nicole from Kings Park. Nicole?
Hi, how are you?
I'm great.
So, good. So March 20th, I was tested positive for COVID-19. For about a week now, I've felt a lot better. I have not ran a fever. I have no symptoms. So I was just wondering how long I'm contagious for after feeling better.
I don't know if there's necessarily the same answer if you ask multiple different people, but in general, if you've been fever-free for 72 hours after quarantining for at least a week to 2 weeks, you should be less contagious. But again, there is still a chance to transmit it after that period of time, so you do still want to practice social distancing.
Okay. Vicki from Merrick? Vicki, you there?
Yes, I am.
What's your question tonight?
Okay, I always have like a very dry nose, and I use Vaseline in my nose, And now from washing my hands so much, I'm using a lot of moisturizer. Now, is the stickiness from the Vaseline and the moisturizer something that the germs can cling on to? Is it better not to use any kind of stuff like that?
No, I would say as long as you're not overusing those products, it's probably safe. The truth is, if you are keeping your nose moisturized and you're keeping your hands moisturized, you're probably less likely to fidget or touch your face, and so you may actually reduce your chances of passing the virus around.
Okay. Doctor, let me ask you this. We're hearing some conflicting reports on the federal level. Some officials are saying we're potentially going to have some miracle vaccines coming out, the hydroxychloroquine and others. And then we're hearing from health professionals, Dr. Fauci and others, who caution that these could take a long time, the clinical trials. What's the main thought in the health profession as far as these potential vaccines?
Well, the hydroxychloroquine is an anti-malarial medication that's been around for a long time. We're using it to treat some very severe cases of the coronavirus. Still a little bit unclear how effective it is. In terms of an actual vaccine, I agree that it may take a while to come out. Before any vaccine is released, we need to make sure that it's safe. And of course, the medical community would never want to hurt anybody with a vaccine. And so we really do need time to make sure that it's safe.
Okay. We're going to take a real quick break. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you. Call us at the number right there at the bottom of your screen, 516-393-1800. If it's busy, call back. We will get to your questions. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in our doctor, Dr. Adam Berman, Associate Chair of Emergency Medicine at Long Island Jewish Medical Center, pulling some very long hours right now and still taking the time to answer our questions. Before we go back to the phone lines, let me ask you this, because Dr. Tony Fauci yesterday, basically the nation's infectious disease specialist right now, gave us a pretty stark numbers. He said we should be prepared for 100,000 to 200,000 deaths in the next 2 to 2.5 months. Can our healthcare system handle that? Right? You know, the numbers have to be staggering to have that many deaths.
Yeah, the numbers are staggering. But the reason that we're asking people to sort of stay in and quote unquote flatten the curve is so that the healthcare system does not get overrun by that number of people. I think that we can handle the number of people that are going to be coming through the healthcare system as long as we practice social distancing and flatten the curve.
Okay. Back to the phone lines. Connie from Medford. Connie?
Yes.
What's your question tonight?
My question is, I got tested with virus and it's March 28th. Now, the only the symptoms that I have is only fever and headache, but it's only in the evening. In the morning, I'm fine.
Doctor?
That's it.
Oh.
I would say that can be consistent with some viruses, including the coronavirus, to not have a fever all day. The important thing, though, is to take medications to lower your fever when you do have it, because that'll help you to feel better and also be able to stay hydrated and rest and to recover and to let this pass.
Yeah, and Connie, good luck with that. Call your doctor and make sure you follow up with that. Sharon from Mauritius. Sharon?
Hi, how are you?
I'm great. What's your question?
Okay, my question is I was around 2 people that I have learned now have tested positive. I have gotten tested 2 days later, and then 3 days after that, it was negative. So could I still have contracted it, even though I was only tested 2 days later after I had seen those 2 people?
It's certainly possible that you have contracted the coronavirus, but the truth is, if you're asymptomatic and you're feeling good, the only thing to be recommended would be to make sure that you, for 14 days, are staying away from others, which I know is difficult. there are a lot of people who have the virus but don't have any symptoms.
Okay. Yeah, good luck to you too, Sharon. Debbie from Greenlawn. Debbie? Debbie, you there?
Yeah, I'm here.
What's your question?
My question is for my son. He tested positive on Monday, and he has a 5-month-old. He wants to know, like, how long is he supposed to quarantine to stay away from the baby? He's in the house with the baby, and he's quarantined himself. How long do you stay away from, stay away?
Yeah, that's difficult. I think that 14 days is sort of the standard answer, but I would probably also recommend speaking with the baby's pediatrician to see if pediatricians are recommending anything different, because obviously children and adults have different immune systems.
Yeah, and one of the, and you could speak to this as well, Doctor, one of the problems though, the baby may be able to handle this quite well, but if the baby then comes in contact with someone who's vulnerable, it can be spread, right?
Right. Even if the baby doesn't show symptoms, the baby can still pass it on to other people, and some of them may not deal with the virus well.
Okay. Donna from Patchogue. Donna, you there?
Yes, I am.
What's your question tonight?
I work in medical records off-site from the hospital, and I've heard that there was positive testing. I wanted to find out how long the virus stays on paperwork.
I honestly don't know the exact amount of time, but we do know that there are some surfaces that the virus can stay on for hours to days before not being active anymore. So you should still be very careful.
Okay, Debbie, New Hyde Park.
Hi.
Hi, how are you?
Okay, and you? My question is, I have 2 elderly parents that live with us, and we're not sure. We're hearing conflicting remarks about, is this coronavirus airborne? So if we go outside?
Doctor, yeah, I'm hearing that too, especially on social media. A lot of people are saying that there's conflicting reports out there. What is the consensus?
The virus is definitely something that can stay in like humidified vapor in the air. One of the reasons that we recommend that people stay 6 feet apart at least is because the virus can stay in humid droplets in the air suspended for up to about 6 to 10 feet around you after you've sneezed or coughed. So it can be suspended in air, yes.
Okay. And Doctor, let me ask you this. We're now hearing conflicting reports about wearing masks. What's your take on whether we should all be wearing masks when we're out in public?
Right now, it seems like it's probably safe for us to continue wearing masks. The safest thing is if everyone would be wearing a mask, which is obviously not realistic. However, if 2 people are interacting with each other and they're both wearing a surgical mask, that's the safest scenario.
Okay. And what can we do as a public for you guys right now on the front lines? Well, what do you guys need from us?
I would say that the thing we continue to stress is to stay home. I know that's difficult. I know that people want to get out. The weather's getting nicer, but staying home is going to help us to be able to take care of all of these people and to make sure that we can do the best that we can and to shorten the course of this as much as we can.
Okay. Well, Dr. Berman, thank you so much for everything you do. I feel like I say that every night, but you guys really are the heroes in our life right now, and you're really saving us. So thank you so much. You're watching our coronavirus pandemic special report. We'll be right back.